Good evening, everyone. Thank you all for hopping on here and joining our webinar. We will begin shortly. We will just let all attendees log in. We'll begin shortly after 6:30. Again, thank you for coming. Good evening, everyone. I'd like to give everyone just one more minute to join, and then we will begin. I see people still filtering in, so just want to allow enough time. Hello, everyone. Welcome to today's installment of our Cancer's Health Education webinar series. I'm your host, Jill Akers, Marketing Specialist at Franciscan Health. I am excited for our team to share some great information and health tips on cancer clinical trials. Our experts will help you better understand what are clinical trials, who can participate in clinical trials, what the risks and benefits of clinical trials are, the use of placebo in clinical trials, what costs are associated with clinical trials, and what different types of clinical trials are available. Before we get started, I'd like to share a few housekeeping items. For this virtual event, participants are muted. We ask that you remain muted to help us avoid background noise and interruptions. If you have questions to ask the presenter during the presentation, please type them into the window chat. We'll be answering your questions at the end of the webinar. Kirsten is our administrator. She'll be taking care of everything on the back end. So if you do experience any technical issues, just type them into the chat window and we'll work to resolve them. If you miss anything, no need to worry. We'll send out the recording of tonight's presentation to you in a follow-up email, along with some great resources for you to download on today's topic. Franciscan Health is home to some of the country's most well-respected physicians and clinical specialists. I'm excited to introduce you to Dr. Taylor Ortiz, oncologist and hematologist with Franciscan Physician Network and medical director of our oncology research program. Dr. Ortiz completed his training at Harvard Medical School and the Dana-Farber Cancer Institute and is board certified by the American Board of Internal Medicine and Medical Oncology and Hematology. He has been practicing medicine since 2004 and been with Franciscan Health since 2017, and dedicates his profession to treating cancer patients in Indianapolis and Lafayette. Dr. Ortiz takes care of patients with all types of tumors, from breast cancer, lung cancer, and colon cancer to blood disorders. Dr. Ortiz enjoys taking care of patients with cancer and is excited about how much science has advanced so that he can offer exciting new treatments that weren't available just a few years ago. Before we begin, we'd like to get a better understanding of who our audience is. You'll see on the screen now a poll that you can choose your answer. The question is, why are you attending this webinar event? I want to learn about cancer clinical trial types. I have or had had cancer and want to learn about clinical trials. I am currently in a cancer clinical trial and want to learn more about different types. So if you can select your option, and then we will view the answers shortly. Great, thank you everyone for filling out the survey. Looks like we have a variety of individuals. Thank you for participating. Now, without further ado, please welcome Dr. Ortiz as he walks us through understanding cancer clinical trials.
Jill, thank you so much for that introduction. And I want to thank all the attendees for tuning in this evening. That photograph on there, I'm so glad that you don't get to see the picture of me right now. Yeah, that tiny little picture right there. That wasn't taken in 2004 when I first started, but there's definitely been some new gray hairs that have come in since COVID. So they'll just have to take my word for it that I look exactly the same as I did those years ago. Just trust me on that one. Anyway, I thank all of you guys for attending this discussion on cancer clinical trials. As Jill mentioned before, I've been very interested in the mechanisms underlying cancer and identifying new treatments for cancer. And one of the reasons I really got started in oncology those years ago in 2004 or before was we were learning at that time new drugs that were targeted therapies that were available, just starting to be available to patients back then. And over the last 15, 16 years, so many new drugs have been made available, so many new options for treatment. And this is really thanks to the development and participation of patients in clinical trials. So I just want to start off by thanking all patients and family members who have participated in clinical trials, because without those folks, we would not have all of these new therapies that have been able to advance treatments for patients with cancer. So thank you to all families and patients who have been a part of clinical trials in the past. So with that, I'll tell you a little bit about what I'd like some takeaways to be from this evening's discussion. Patients who have exhausted all their treatment options can look into clinical trials for alternative therapy, but this is not, clinical trials are not just for patients who have gone through all their treatments. This is a common misconception, is that patients can be at the beginning of their disease course, or could be later in their disease course and may be eligible for clinical trials. So it's a common misconception that patients are only eligible for clinical trials when they've exhausted everything else. So clinical trials are available for patients at a variety of times during their illness. So that key takeaway should be rewritten to say that patients at any point in their treatment course may be available for treatment trials. Drug studies that are FDA approved, drugs trials may use drugs that are FDA approved. So some clinical trials will be using medicines that are already used for other reasons. So keep that in mind, that not every drug that's used in a clinical trial is brand new, just out of, for example, studies in mice or a few studies in humans. Many drugs have been used for other purposes, but are now being studied in a new circumstance. One thing to also realize that patients are randomized in some types of clinical trials, so we'll talk about that shortly. And our clinical trials, and every clinical trial that patients participate in, are reviewed by an investigational review board to ensure that the studies are ethical and appropriate for patients. Because I know sometimes patients and families worry about what the risks are for participating in a clinical trial. So I'll talk to you guys about that a little bit more. Next slide, please. So what are oncology clinical trials? And this question may seem straightforward, but there are so many different types of trials that I'm going to go into that in some more detail. Clinical trials are experiments to learn more about cancer, its diagnosis, its causes, and its treatment. Some trials focus on understanding the cause of cancer, what triggered someone's cancer to begin. Others may study how we diagnose cancer, so we can try and identify and treat a patient's cancer earlier than we previously would have. Many trials, and these are the ones that most of our discussion today will focus on, are focused on improving the treatments that are out there. But again, many drug trials are performed early in a patient's course, in the middle of the patient's course, or later in a patient's course. So patients may have been on therapy for years and participate in a clinical trial, or patients may be brand newly diagnosed and participate in a clinical trial. There are also some studies that focus on reducing the risk of developing cancer and reducing the risk of recurrence. So those are also really interesting studies. And just as I mentioned before, clinical trials are not only for patients without other treatment options. Clinical trials may offer an additional option that's in addition to the normal standard of care. So I'm going to be using that phrase, standard of care, several times during tonight's discussion, because that's important to know that clinical trials really must focus on treating patients with a standard of care if one is currently available, and then often adding something to that. So that's really important to think about. Next slide, please. So let's talk a bit about the benefits of participating in clinical trials. And I touched on some of those at the beginning already, and when I was thanking those patients and families for participating. But clinical trials may offer a patient a beneficial new treatment before it becomes widely available. We hope that drug studies that are a part of a clinical trial will eventually be beneficial to dozens, hundreds, or thousands of patients. And by participating in a clinical trial, patients may have the opportunity to get access to a drug that otherwise would not be available because it's not yet approved to be used for that disease. Also, participation in clinical trials increases our knowledge about cancer and its treatments. And that's the way that we continue to move forward and why we have better treatments today than we did 10 or 15 years ago. And even in some diseases, we have better treatments today than we had 6 months or 1 year ago, which is always a really exciting thing about the field of oncology. Another important and beneficial reason for participating in clinical trials is that trial patients are often more frequently monitored. And that's because if we're giving a patient a new treatment, we need to monitor those patients extra closely to make sure that we identify any new problems or issues that may arise during the course of their treatment. Because of that, patients may have more frequent visits, but more frequent visits often means that patients are going to have a little extra eye on them. There are more folks that are reviewing these patients in our offices to ensure that the patients are doing well. And sometimes that is beneficial to ensure that patients are tolerating treatments well, and that we're addressing any issues or concerns that come up during the course of their study therapy. Next slide. Okay, so I think Jill, is this one for me to talk about this question for the folks to answer in the audience?
Yeah, this is a poll question. So the audience can read it and the poll box will pop up again.
Okay, so I'll read this aloud. Which of the following is not a benefit of participating in clinical trials? A, trial patients may be more frequently monitored. B, trial patients can receive a new treatment that is not widely available. C, a patient may benefit other patients with cancer. Participation may benefit other patients with cancer. Or D, trial patients will receive a new car. So I hope folks will figure out which one is not a benefit of participating in a clinical trial. We'll give you guys a second to answer that. Okay, well done. So yes, new cars are not a benefit of participating in a clinical trial. So I'm sorry if you guys are disappointed that we don't have a car waiting for everybody who participates. But hopefully a lot of other benefits will go along with participating in a clinical trial. Next slide, please. Safety is a really important part of clinical trials, and something I spend a lot of time discussing with my patients and their families. Because again, clinical trials are a type of experiment where we are testing to see if a certain treatment may offer a benefit to a patient over the standard of care. This is for treatment trials, that is. So there may be known or unknown side effects to clinical trial therapies. So that is something to be aware of when you're participating in a trial, that there may be things that come up that were not anticipated prior to the patient beginning that clinical study. Clinical trials are reviewed by one or more institutional review boards. And an IRB, as I mentioned earlier, is really a really important, critical part of how clinical trials are evaluated for their safety, both before, during, and after participation in clinical trials. IRBs review the safety and ethics of clinical trials to ensure that patients are receiving the appropriate therapies. There's nothing that would be otherwise inappropriate or unethical. And one quote from the National Cancer Institute: "The purpose of an IRB is to ensure that both in advance and by periodic review, that appropriate steps are taken to protect the rights and welfare of humans participating as subjects in the research." I can't overstate how important it is that we value our patients and their families who participate in trials, because again, this is how we learn and move our field forward for both our patients today and our patients in the future. So we know that if patients are going to participate in clinical trials, that we need to ensure that they are safe and ethical. So that is a big part of clinical trials. Next slide, please. So let's again talk about different kinds of things that could be tested in clinical trials. As I mentioned, there may be drugs that have never been tried in humans before. These are part of certain studies called phase 1 studies, which I'll come back to in a minute. But many trials use drugs that are already FDA approved, but are used for other purposes. So for example, one study that we've had patients participate in used a drug that's approved for stage 4 breast cancer, and we know that it benefits those patients. However, in one clinical trial that we participated in, patients were given this drug to help treat their early stage breast cancer, stage 1, 2, or 3, to see if this drug might reduce their risk of a relapse. So that's one example of a clinical trial of a drug that's already been approved for one use, but is being studied in a clinical trial for a different use. Sometimes vitamins are a part of clinical trials. For example, we do have some studies currently at Franciscan of colorectal cancer, where vitamin therapy is a part of it. There may be studies of dietary changes, exercise, counseling around diet, exercise, and also sometimes parts of studies. There may be studies of medical devices, which I'll touch on a little later. And some studies are observational, where the goal is not so much to give a patient a treatment, but for us to follow a patient who's receiving a treatment so that we can see how they do on that therapy, and we can better understand that if we have dozens or hundreds of patients that we're observing, this may give us insights as to which therapies may be better or worse, or if there are certain indicators that may help us understand if a certain treatment might benefit a certain patient. Next slide, please. These are a couple different types of studies, and I don't know that I would exactly call these trials, but these are studies that are also important for us to understand cancer, but not so much of how to treat cancer. These are diagnostic and biorepository trials. And these studies use blood tests, imaging studies, etc., to diagnose or evaluate someone with cancer. So we may be doing tests of certain blood draws or certain testing that we do on a patient's tumor sample to better help us diagnose someone with cancer. We also have some things where we can take a patient's stored sample of their cancer and test that sample to help us better understand their cancer. These are called biorepository studies. In these studies, patients contribute a tumor sample, and these samples are often already stored in our laboratories. But a patient can voluntarily allow part of that tumor sample to be submitted to a biorepository so that it could be studied and tested to help us better understand patients with cancer and hopefully develop new diagnostic mechanisms, new treatments in the future. So those are great ways for patients to participate that don't necessarily involve a drug. Next slide, please. Here's an example of a cancer device trial, one of which we currently have open at Franciscan for patients with lung cancer. This is a study of a medical device. This is a type of device where patients with lung cancer are treated with this device in the LUNAR study, where alternating electrical fields are applied through these pads. This is a study where we're trying to understand if applying this alternating electrical field may offer a better outcome to patients with stage 4 non-small cell lung cancer. This has been studied with other tumors and is currently approved for certain types of brain tumors. And we're trying to learn about this in patients with lung cancer as well. So this is an example of one cancer device trial. Next slide, please. Now I'll get into more of the conventional treatment trials. And these are really the most common types of studies that are available for patients with cancer. These treatment trials use experimental treatments to try to improve cancer therapy. And these trials go through different phases of development. Phase 1 trials really are designed to determine the safety and dose of a drug for a patient who's participating, who may later participate in a drug trial. So for example, we may be studying a drug in a phase 1 trial that's only so far been tested in cells in a petri dish or mice in a lab. But phase 1 trials begin where the drug is given at a very low dose, and the dose is slowly escalated over time to find out what the correct dose is for patients to be studied later. These trials are not necessarily designed to find out if a drug is effective or not, but they're mostly designed to help us determine the safety of the drug and the correct dose to be used in later studies. So it's important that if you're participating in a clinical trial, you need to understand what phase of the trial is so you understand what the goal is. Phase 1 trials may not be appropriate for patients with early stage cancers, and usually early stage cancers are not, I guess I should say cancers who have otherwise not been treated are usually not eligible for phase 1 trials. But certainly discuss this with your treating physician. Phase 2 trials get into where we're trying to study the activity of a drug. So once we've learned the correct dose and we've learned about the safety of the drug in a phase 1 trial, a phase 2 trial study is opened. And in a phase 2 trial, we're actually giving the dose that we think is correct, and we're trying to find out if this drug has any activity in treating a patient's cancer. Do we start seeing some improvement on a CAT scan or a blood test? That's where this is first identified in phase 2 trials. Phase 2 trials typically involve dozens or hundreds of patients, whereas phase 1 trials may only involve a dozen to 100 patients as they're trying to figure out the correct dose. Phase 3 trials are the really large trials. These are where we are trying to compare the experimental treatment to the standard therapy. Again, I talked before about standard of care treatments. And in a phase 3 trial, I'm going to take you through some pictures of what phase 3 trials are in a couple minutes. This is where a patient may be randomized to receive treatment A or treatment B. And for example, treatment A may involve a standard of care drug, and treatment B may involve the standard of care drug plus the experimental drug. So phase 3 trials often, and like I said, involve hundreds, if not thousands of patients, where we're trying to find out if our experimental treatment is better than, equal to, or hopefully not worse than the standard of care treatment. Phase 4 trials are done after a drug's been previously approved, and phase 4 trials provide us with more data of a study drug over a longer period of time. So we value patients' participation in phase 4 studies because although this drug may already be approved, patients who participate in phase 4 studies help us learn more about side effects that may not have been initially identified or give us more long-term information, and also gives us more real-world information after the drug has been approved. So hopefully this gives you some idea about the different phases of clinical trials. And again, as I said before, it's really important that when you're speaking with your oncologist, that you ask about what phase is this clinical trial and what's the goal of the clinical trial. While I'm thinking about that, some important questions to ask additionally would be to ask your treating oncologist, what is the standard of care for my cancer at this point in time? And sometimes there are many different standards of care. And then to ask your oncologist how a clinical trial fits into the standard of care treatment for your cancer. I think that really will help you understand how your treatment, if you're participating in a clinical trial, compares to what someone would be getting if they weren't on the clinical trial. So it's important to understand that. Next slide, please. We talked about some of the benefits of participating in clinical trials. Let's talk about the risks of clinical trials. And many of these I've mentioned before. But one important thing to keep in mind, and I'm sure all of you are aware of this, that experimental drugs may or may not be effective and could potentially be harmful for patients participating in a study. So that's one reason why patients are monitored very closely when they are participating in treatment trials, to ensure that we identify any potential side effects, and that information is shared with other sites that are also participating in the same clinical trial. Another important point that I'll mention is that these, what we call adverse events or side effects of a treatment, are all, again, aggregated together and shared with other places around the country or often around the world that are also participating in the same studies. Clinical trials may involve more visits than usual. And I tried to tell you earlier that part of that is a good thing. So patients are monitored more closely, but this may involve more visits back and forth to your doctor's office. And sometimes travel can be difficult for certain patients. But we'll also talk about there are ways that sometimes the difficulties with travel can be mitigated. Also keep in mind that in certain clinical trials, there may be a control group where patients are receiving the standard of care treatment. And I know I've said that phrase many times, but I think that's really important to understand that certain studies may randomize a patient to receiving the standard of care treatment, the one that is currently in active use for patients with a certain diagnosis, or may be randomized to the treatment group. So it's important to realize that some patients may be getting the control therapy, and oftentimes the patient or the treating oncologist won't know which treatment they're getting. I'll come to that in just a moment. Next slide, please. So that's where we're going to get into blinding in clinical trials. I'm sure many of you have heard this phrase about a blinded clinical trial, but a blinded trial means that the patient and usually the treating physician do not know whether the patient is getting a standard treatment or the experimental treatment. And this is done, that's called double blinding, when both the patient and the physician don't know what therapy the patients are getting. This is done so that the patient and the treating physician do not introduce any bias by trying to make judgments based on what they know that the patient is receiving. Bias in a clinical trial is something that can make it difficult for us to understand whether the drug that's being studied is different from the standard of care. So by blinding it, where the physician and the patient don't know if they're getting the study drug or the standard of care, it helps us better preserve the accuracy of the trial to ensure that we are getting accurate results, that we know that the study drug is causing the effects that we see. So blinding is really important in helping us understand that. Now, keep in mind the study sponsor is aware of which treatment the patient is receiving. So behind the scenes, there is knowledge of what drug the patient is receiving. And for many trials, we can, if absolutely necessary, because of an emergency, we can unblind a patient to find out which they are receiving. But that blinding is really important in preserving the integrity of a clinical trial. Next slide, please. I've touched on placebos a few times, and I'll bring it up again now. But placebos, again, are important to help us ensure that we know what effect our study drug has, because placebos actually do have a real effect. The placebo effect is documented and real. So by giving patients a placebo, where, for example, a patient may be getting the standard of care treatment plus, I'll say, sugar pill, or maybe receiving an infusion of just saline. This is important so that we, again, don't bias the study, and it preserves the integrity of a clinical trial. The researchers want to be as certain as possible that the results of the trial show whether the treatment is safe and effective, and they're not just seeing the placebo effect. And keep in mind, as I know I've mentioned this many times, but I'll mention it again, placebos are not used in place of standard therapy. That would be unethical and is not done. Placebos are used in order to help us blind and protect the study's integrity, so that both the treating physician and the patient participating in the study are not aware of whether they're receiving the experimental medicine or not. Next slide, please. Okay, so why don't we do another poll here? We'll talk about why are placebos used in clinical trials. So if you could please answer this. Do we use placebos in clinical trials to have a placebo effect on patients that adds anticipation for a positive outlook from treatment? Do we do it to mask the drug being used, to help prevent bias, or all of the above? Okay, that's correct. So we use placebos in clinical trials, both to help prevent bias, to mask the drug being used, and to help protect against the placebo effect that is out there. So placebos, again, help us preserve the integrity of studies so that we really know what the outcome is. I'll give you an example that I think is a common example. If the treating oncologist knew which experimental drug that the patient was getting, and that treating oncologist is reviewing the CAT scan. For example, let's say that they see that the tumor on a CAT scan has grown slightly, and they know that the patient is receiving the placebo drug. They might say, "Oh, this drug is not effective yet." So that versus if a patient is receiving a study drug and they see that the tumor is getting slightly larger, they might say, "Well, why don't we give it a little bit more time for this drug to work?" And they may not accurately assess the patient's tumor size growth because they secretly know in the back of their head, "I know that this patient's getting the study drug. I want him to stay on the drug a little bit longer." So this also protects physicians from making decisions for patients based on their biases, because physicians, just as much as patients, want a study drug to be effective. But if the physician is blinded by what type of treatment the patient is receiving, then that helps better protect the outcome of the study. Next slide, please. So let's review, these are called schemas of clinical trials. You can get an example of how a double-blind, placebo-controlled, stratified trial works. So on this slide here, you'll see the R, which stands for randomized. 1-to-1 means that one patient is assigned to each side of the group in an equal ratio. So half of the patients will get the gray boxes above, and half the patients will get the teal boxes below. In this study, the drug capivasertib plus paclitaxel is given to people that are randomized to the investigational arm above, and a placebo plus paclitaxel is given to the patients in the standard of care arm or the control arm below in teal. So as you can see, all patients are receiving paclitaxel, both in the gray boxes, which is the experimental treatment, as well as in the teal boxes in the standard treatment. So this is why, again, patients are receiving the standard of care medication in both arms of the study. But as a part of the clinical trial, half of the patients are going to be receiving a placebo with a paclitaxel, and half the patients will be receiving the capivasertib plus the paclitaxel. So again, I think it's important to know that all patients are receiving the standard of care paclitaxel, but if a patient chooses to participate in this study, they have a 50-50 chance of also getting this study medication, capivasertib. Stratification in a clinical trial is a little bit more complicated, but what that means is that when we randomize patients to a clinical trial, we try to ensure that we get a well-balanced group of patients who may have certain characteristics. In this study, patients are stratified based on a certain mutation called PIK3CA, AKT1, or PTEN. And this to ensure that we don't accidentally, through randomizing, have 150 patients with PIK3CA in the gray box and only have 75 patients with PIK3CA in the teal box. That could lead to an unbalanced study. So that's something that is done behind the scenes to ensure that the studies are that the different arms of the study are well balanced. The upper and lower boxes we call the arms of the study. So we have the upper box, which is our experimental arm, and the lower box, which is considered our control arm or standard of care arm. Next slide, please. This is another type of randomized trial. This is called a randomized open label trial. So this is different from a blinded trial. As you might know from what I shared earlier, by this being an open label study, which means that there is not blinding, there could be potential bias, but sometimes you can't do a study as a completely blinded study, or it's not felt to be appropriate. So in this study, patients are randomized 1-to-1, again, 50-50, to the control arm on the right. So I'll start with that arm, the standard of care arm, which is an immune checkpoint inhibitor drug, plus an additional drug called docetaxel. In the experimental arm on the left, you see that patients are randomized to that same therapy, the immune checkpoint inhibitor plus docetaxel, plus they're also receiving the experimental treatment. And this experimental treatment is that medical device that I showed you earlier in the LUNAR trial, where those alternating electrical fields are applied to a patient's chest. We don't blind this because a patient's going to have these electrodes on their chest or not. And in this study, they're not requiring patients in a control arm to wear fake electrodes on their chest that aren't connected to electricity. So in this study, the patients know whether they have the electrodes on their chest or not. But that is one potential risk to this particular type of trial, is that there could be bias that is introduced by the providers and patients, knowing that half of these patients are getting this experimental therapy and half of them are not. So that's an example of an open label study that is still randomized, but is not blinded. Next slide, please. This is a kind of a complicated slide, so I'll try and explain it to you. But this is an interesting study where we are studying patients with metastatic, which is also called stage 4 HER2 positive breast cancer, with patients with current or planned HER2 targeted therapy, including a drug called trastuzumab. In this study, if patients are receiving a drug that can have an effect on their heart, we want to better understand if there are certain medications that may reduce the risk of heart problems occurring during their treatment. So if we move down here to the step 2 registration randomization, in this study, patients are reviewed to see if they're currently taking a medicine called a beta blocker, ARB, or ACE inhibitor. If patients are currently receiving these medicines, which are commonly used to treat heart disease, high blood pressure, or congestive heart failure, then those patients are moved to the arm on the right, where they are just observed and there's no randomization. That's on the side of the right where we see yes in the registration under arm 3. If patients are not currently receiving those drugs, the beta blockers, ARBs, and ACE inhibitors, on the left side of the screen, you'll see that patients are randomized. Half of the patients would get carvedilol and half of the patients would receive no prophylaxis. And the results of this study are us trying to better understand between arm 1, arm 2, and arm 3, how do patients do if they receive carvedilol, no prophylaxis, or continue on the therapy that they were previously receiving, to find out if these patients have better heart results, better cardiac outcome by looking at an echocardiogram. So this is a really interesting type of study where patients who may already be on a certain drug may just enroll in the study and we can observe them. That's really valuable information for us. But patients who are not receiving those drugs, the beta blocker, ARB, or ACE inhibitor, could be randomized to receive carvedilol, which is a drug that's approved to be used for heart disease, or to be observed. So that's an interesting type of clinical trial to look at heart outcome. It includes an observation arm and an experimental arm. Next slide. Okay, let's talk a little bit about expenses of clinical trials. So many patients will ask about what kinds of costs they might have to take on by participating in a clinical trial. And there is good news with that. The study sponsors pay for the experimental treatments and the experimental therapy specific follow-up that is outside the course of normal care. And what that means is that if we're giving a patient an experimental drug, they aren't charged for that. If we're doing a blood test to study that experimental drug, the patients aren't charged for that. The insurance isn't charged for that. Those expenses are borne by the study sponsor or by our hospital. But patients and their insurance will be billed for things that are part of the normal course of patient care. So if patients normally get CAT scans every 6 to 9 weeks as a part of their cancer treatment, then the CAT scans will be submitted to the patient's insurance for coverage. But the good thing is the experimental parts of the clinical trial are covered by the patient's by the study's sponsor. Another important part, and I mentioned earlier, is about travel expenses. And one thing to always ask about by your treating oncologist is if you could be reimbursed for travel to and from the hospital for participating in a clinical trial. We know that sometimes it involves a lot of driving, and gas is certainly not cheap. So that is one way that oftentimes patients and their families can receive some reimbursement so they don't have to suffer the costs of driving back and forth to their appointments. So please ask that because that is frequently available. Next slide, please. So let's go over some key takeaway points, and I'm sure all of you should be aware of these by now. Clinical trials are reviewed by an investigational review board to ensure that they are safe and ethical. Clinical trials are not the only option available for patients. Clinical trials are not only available for patients with no other treatment options. As I mentioned, patients may be eligible for clinical trials even if they haven't started on their treatments yet. So it's a common misconception that clinical trials are only available for patients who don't have other treatment options. And this number 3 is a little bit of a trick question. Randomization helps to ensure that no one knows what treatment a patient is receiving. That is only partially true. Randomization helps to ensure that we balance a clinical trial. It's true, randomizing patients in clinical trials helps ensure that we have, in a blinded trial, that we don't know if a patient's getting treatment A or treatment B. But the goal of randomization is really to ensure that it's balanced, that we have equal types of patients in both arms of a study, or multiple. If there's 3 arms of a study, that we have equal types of patients that are in the different arms of the clinical trial. So, so randomization, again, is an important part of studies that have multiple arms. Next slide, please. Well, with that, I want to thank everybody for their attention and participation. My name is Dr. Taylor Ortiz. I love taking care of patients with cancer. It's what I do. I love talking to patients about clinical trials. And I, again, want to thank all of you for listening in and participating today. And again, thank all the patients and families who have participated in previous clinical trials, because without them, we wouldn't be where we are with improving cancer care for our patients. So with that, I'll hand it back over to Jill.
Thank you, Dr. Ortiz. Very, very nice. At this time, we would like to open our chat window and box for anyone to type in questions for Dr. Ortiz about his presentation. We did have one question come in during the presentation, and it was about who pays for the treatment, the trial. So I think you had went over that just a minute ago, Dr. Ortiz, but do you want to touch on it again?
Yeah, so I think that's a great point, and I'm glad that was asked. Thank you for that question. Who pays for a clinical trial? So clinical trials are paid for by a variety of different entities. So there are some trials that are sponsored by pharmaceutical companies. Those pharmaceutical sponsor studies are frequently paid for by the pharmaceutical company that is developing the drug. For other types of trials, these are often called cooperative group trials or investigator-initiated trials. These trials may be funded by the hospital itself, or may be paid for by the researchers' research funds to help pay for the study. So that's always a good question to ask if you're participating in a trial, is who is paying for the study. But as I mentioned before, experimental drugs that are being studied in a clinical trial are often paid for by the pharmaceutical company who makes the drug. And other trials may be sponsored by these cooperative groups, where the hospitals or the investigators' research funds provide financing to pay for the conduct of a clinical trial. Clinical trials can be very expensive to conduct, involves a lot of folks behind the scenes. So I'll give a little shout out to our clinical research coordinators who we have at Franciscan, who are fantastic and help ensure that we're taking great care of patients, and that we're providing opportunities for patients who are interested in clinical trials to participate.
Wonderful. That's very, very insightful. Thank you. If any attendees do have questions, please type them in the chat box, and I will read them to Dr. Ortiz and while he answers. We do have another question. When and who should I ask about a cancer clinical trial?
Sure. So, I would recommend that patients and families talk to their oncologist about clinical trials at any time. This can be at the first appointment or a later appointment, but it's important to ask your oncologist about whether there may be a clinical trial that's available for you. And if there isn't a trial available for you now, there may be trials available for you in the future. Trials may be available at Franciscan, but trials may also be available at other sites or locations within or without the state. I think it's important to ask your treating oncologist at any time about whether a trial is right for you. And I would certainly recommend not waiting until I guess I would say things get more challenging, but thinking about clinical trials early is very important.
Wonderful, thank you. Another question is, can you leave a clinical trial?
Yeah, great question. And I'm glad somebody asked that because I should have touched on that. Yes, it is someone can choose to come off the clinical trial at any point in time. It is not a contract to participate in clinical trials. And if a patient begins on a clinical trial and doesn't feel that they wish to continue participating, they can withdraw from the study at any time. So it's very important to think that, to remember that at any time, if a patient becomes uncomfortable or feels that they don't wish to participate for any reason and wish to withdraw from the study, they certainly can. One thing that I would ask is that if patients are participating in a clinical trial and choose to withdraw, it's still very helpful for the clinical trial for us to be able to follow these patients to see how they do, because we can at least continue to learn from these patients. So I would ask that if a patient does choose to withdraw from a clinical trial, to allow us that are doing the research to continue to review their outcomes is really important for us to learn about these patients, even if they're no longer, for example, receiving a study drug. So yes, thanks. That's a great question.
Sure. We've got a few more. If someone asked, if I am in remission but taking an anti-estrogen pill for another 8 years to prevent breast cancer from recurring, how can I find a clinical trial in which to participate?
Yeah, that's a great question. So there may be studies available for patients who are already on a hormonal therapy that are in their observation period, or their post-treatment period, or their prevention or adjuvant period. So I would definitely ask your oncologist about that to see if there's a study that you could still participate in. As I mentioned before, we did have a study that was previously available. It's closed now for patients who are receiving hormonal therapy for their breast cancer during that 5 to 10 years that they were on hormonal therapy. That study is not currently open, but it does not mean that another study may not open anytime soon. Something to keep in mind is that clinical trials open and close frequently. Sometimes a study fully enrolls across the country or around the world, and we close that trial because it's enrolled enough patients to be able to answer the questions that we want to answer. But just as frequently, new trials open up, new studies become available. So it's something to frequently talk about to your oncologist to see whether a study may be an option for you. There are websites out there to look for clinical trials, and I will say that those websites are sometimes challenging to use for people who are not in the medical field. But one website that is frequently used is clinicaltrials.gov. And clinicaltrials.gov contains all of the studies that are currently open in the United States. But because it contains all the studies, it can be really difficult to look through. Just as when you Google something and you come back with 50,000 answers, the clinicaltrials.gov website, if you submitted something like lung cancer or breast cancer, may come out with 300 results. And that can be really overwhelming to go through to find out which studies you might be eligible for. And that's why I really recommend talk with your oncologist about clinical trials, because he or she can help you better sort through all those studies that may be available to find something that really would be a fit for you.
Okay, thank you. We've got more questions. Are these trials done in Indianapolis or some in Northwest Indiana?
Yes, great question. We have studies open in both places. So from Indianapolis and Mooresville and Lafayette to Northwest Indiana, we also have clinical trials available at all of these sites. Different studies may be available at different sites. So it's important to talk to your oncologist about what studies might be available for you at your cancer center, or to find out if there's not a study available for you at your cancer center. Would somebody be interested in traveling to another center to participate, or could a study that's available elsewhere be moved and made available where you're being treated. That sometimes can happen too. That can sometimes be a challenge, but on some occasions, if a trial is opened up at one place, but not where the patient is receiving their care, sometimes the trial might be extended or made available at a different site to make it more available for the patient. So certainly ask your oncologist. I know I've said that many times, but certainly ask your oncologist about clinical trials and what might be available. And consider that sometimes traveling for a clinical trial might be a good option. Some clinical trials only require you to visit maybe once a month, and sometimes that's not too difficult for patients. But other trials that require very frequent visits, that sometimes could be a burden. So that's something to consider as you're looking at the clinical trial and the type of travel that might be required.
Okay. The next question is it wise to enter into 2 clinical trials, one and then the other afterwards?
That's a good question. That one, I would say it really depends on what the trials are. So clinical trials in general, I think, are really important ways for us to advance cancer treatment. I know I said that many times and I'm a broken record now, but I really believe it. So in general, going from one clinical trial to another clinical trial is a great option. It really is. But again, always ask your treating oncologist, what is the standard of care for my cancer? And how does that compare to what the clinical trial offers? Sometimes the standard of care treatment may be part of the clinical trial, but sometimes the standard of care treatment may be a treatment that patients are not interested or willing to try. And therefore, by participating in a clinical trial, they may have an additional option that would otherwise not be available. There are some studies where patients who choose or say that I do not wish or feel comfortable receiving a certain medicine because of side effects or worries about that drug. Sometimes there may be a clinical trial available for those patients. So it's something to always ask your oncologist about.
Thank you. The next question is there anything I need to avoid during a clinical trial, such as drugs or procedures?
That really depends on the type of drug that you're receiving. So always discuss that with your CRC, your clinical research coordinator, or your treating physician to find out if there's something that you can or can't do during your clinical trial therapy. I'll say one thing that's come up recently that's very time sensitive, or not sensitive, but appropriate for this time, is that many clinical trials would say that a patient could not receive any other experimental treatment if they are also participating in a clinical trial. Well, as we're all aware, coronavirus happened and the coronavirus vaccine happened. So the coronavirus vaccine, which is currently authorized under an emergency use authorization by the FDA, would normally have been considered not able to be administered to somebody participating in a clinical trial. However, our trial sponsors and IRBs all very quickly realized that we need to allow patients to receive a coronavirus vaccine if they're participating in a clinical trial, because obviously the vaccine is saving lives and keeping people out of the hospital. And it would not be ethical for us to tell a patient who is on a clinical trial that they couldn't receive a coronavirus vaccine. So that's one important part of why IRBs exist, is because sometimes changes have to be made because new information comes to light. And that's the situation that recently happened with coronavirus, where something that we normally would not allow, an experimental vaccine, we did allow because of the potential benefits of that vaccination. So that's something that always ask your oncologist about is, can I receive A, B, or C, or can I take this vitamin or that vitamin, or can I get this procedure done? Always ask your treating oncologist and clinical research coordinator so that you can be sure that what you're doing is okay while you're on a clinical trial.
The next question is, what happens if a person has to move during the trial?
Oh, good question. And that came up with a patient of mine not so long ago. There was a patient of mine who was participating in a clinical trial in the Pacific Northwest. And she was participating in that trial, but ended up moving to Indianapolis. Fortunately, we had the same trial open here, so that patient could transfer from their treating oncologist in the Pacific Northwest to our office, and we could continue that patient on their clinical trial therapy. So that happened, and that was very fortunate. That is not always the case, so that's always something to think about. But if a patient does move or is planning to move, sometimes the treating oncologist can plan ahead to look to see, hey, if you're moving to San Diego, California, there is this cancer center there that has the same study that you're on. So that might help you better find where you would want to transfer your care. So yes, sometimes, and not always, patients can continue to participate in a clinical trial if they transfer to another site that has the same study open. The other thing to think about is sometimes if you're transferring to a new site, maybe that site could open the study just for you. That sometimes is a challenge, and it may not be able to be done because there are a lot of reasons why we have certain trials open, and certain places can't perform every clinical trial. But it's something to always plan ahead about and to ask about if you're moving, to think ahead about whether the place where you're moving to may have that same trial available for you, so you can continue on the clinical trial. Now, that being said, some folks may not be able to continue on the clinical trial and may have to withdraw from the study, which is certainly something that happens, and we certainly understand that.
Okay. The next question is, how do I sign up for a clinical trial at Franciscan?
Sure. So if you are interested in a clinical trial, certainly you or family member or your treating provider, please make a referral to our Franciscan offices, and let them know that when you call the office to make an appointment, that you're interested in a clinical trial, and we can help ensure that that our research team and your treating oncologist reviews your case closely to find out if you might be eligible. So yes. When you make your appointment, please let the patient service representative on the phone know that you're interested in clinical trials, so that we can discuss that with you at your appointment.
Okay. The next question is, what type of side effects would make someone have to leave a clinical trial?
Sure. So this is really variable, but there are a lot of side effects that someone may find that they or that the treating oncologist may find are not appropriate to continue on the study. For example, if a clinical drug was found to show infections or hospitalization, then that might be a study that the patient would be better to withdraw from if the patient was developing side effects that cause them to have an increased risk of infections. Maybe a study drug caused a patient to have a severe rash, or to have nausea that's not able to be controlled. Those may be reasons that a patient may decide that they can't participate in a clinical trial or need to withdraw from it. Certainly, if and I should have mentioned this before, if an experimental treatment is not working as a part of a clinical trial, then you're going to be automatically withdrawn from the study. And I won't say that that's a 100% true, but in general, that if you're on experimental treatment and it isn't working, that experimental treatment will stop. The only reason that experimental treatment would ever continue, which is not often at all, would be if that the patient, the IRB, and the physician all agree that the drug is not working, but that the patient really wishes to continue receiving that therapy because of some continued perceived benefit. But otherwise, if a drug is not working in a clinical trial, we stop the trial and the patient withdraws and switches to a new therapy. So that's something important that I apologize for not mentioning earlier, that if somebody is on a clinical trial and it does not look like that drug is working, then that treatment is stopped and we switch to a new therapy if a therapy is available and appropriate for that patient.
Okay. Well, that was our last question, which means we have come to an end of our time together. Thank you very much, Dr. Ortiz, for sharing all of this great information, and to each of our attendees for joining us for this webinar on understanding cancer clinical trials. We do understand that your time is valuable, so we thank you for prioritizing your health to spend some time with us today. Once again, we'll send you an email with the recording of this session. Feel free to watch it again and share it with others who might find it helpful. You'll also receive a survey about the seminar and its content. Your feedback is truly important to us, and it will help make future seminars better. So please take a moment to fill that out. And on behalf of everyone at Franciscan Health, thank you for being with us and have a blessed day.
Thank you, Jill, and thank you to everybody for participating. I really enjoyed it, and I hope you guys have a great day.
Bye.